Well, we're concerned that the Minister of Health wants to offer 10-year contracts to farm out non-urgent surgical care into the private sector, and we think that's a very retrograde step.
Why?
Well, there are a whole load of reasons, but it will mean there'll be less money for the public sector. It means that the doctors will gravitate into the private sector. There will be no teaching or training. For lots and lots of reasons, it will mean the public sector will go down as the private sector goes up.
One of the points they made in this conversation, Gary, and I mean, obviously it's obvious when you think about it, but I never thought about it. All of the training happens in the public sector. All of the training for new doctors, all of the students, and it happens in the public sector. So if you're weakening the public sector, you're also damaging the future of the New Zealand medical institution, because nothing happens in the private sector. Your thoughts about what he had to say there?
He speaks the truth. So I want to point out to you something he didn't mention, but an incredible condemnation of the way policy is being run. A public hospital trying to do the right thing for patients has an annual budget and struggles to try to put programs in place beyond that. The answer, if you want to hire more nurses or you need more resources, we don't have money and it's outside our funding window. We can't give you that money or give you that assurance. But this government, if you are a private hospital corporation, an Australian multinational like the one that owns White Cross, they are willing to give them a 10-year financial contract. They are willing to give blood-sucking private corporations a 10-year guarantee on public taxpayer funding, our money, and they will not even give the public system a 1-year guarantee that we will have enough staffing a year from now. Now, that can't be done. It's mind-boggling the amount of wool that has been pulled over people's eyes when they hear this stuff. They think, oh, a 10-year contract, that's no big deal. When you understand how incredibly favoring that is of the for-profit system, you just realize that this is just effed up. It's just beyond belief.
So what you're basically saying, if I understand you, is, you guys sitting there in the hospital aren't quite clear on what your funding will be at the next budget. So you can't plan past beyond that, whereas these guys are given a green light for a decade to be able to do exactly what they want to do.
Absolutely. I'll give you a very concrete example. We keep being told in my town that we're going to have a hospital built and it's coming soon. 2032, it's supposed to go operational. But the money for that, for the final stage, like tranche 3 or whatever it's called, stage 3, where they actually build the wards, the patient towers, where the medical and surgical patients will stay overnight, like i.e. the hospital.
Yeah.
That has, the money for that has not been appropriated yet. It's not been guaranteed or set aside. So we are literally being told we're going to get a hospital, but the money isn't quite there yet. And these private hospitals, which are popping up all over the place, private ICUs, $100 million refurbishments and doubling and expansions. You read about it literally on an almost weekly basis. Yeah, there's one. Dunedin, Christchurch, Auckland, massive expansion in the private sector. And they are getting a 10-year contract. It is just turning decency on its head.